And of course, our computer decided to freeze.
Okay.
So,
Well, we had a successful lobby day, successful rally.
okay, go ahead and just talk about this rally.
So
Maybe.
we're very excited about this bill, SB 562, the Healthy California Act. We feel like the time is now. This is a bill that would establish an improved Medicare for all system with covering all the residents of California.
There you go.
Okay.
But are we ready to make
There you go.
healthcare a human right in California?
There you go.
Yes, we are. Yes, we are. Because when we talk about healthcare, we're talking about justice. When we talk about healthcare, we're talking about equality. When we talk about healthcare, we're talking about the society we want to live in. And that society is based on justice and equality. And I am so damn tired of hearing conservatives talk about freedom, as if the freedom to choose a health plan amounts to anything. It doesn't. It doesn't. Freedom means being healthy. Freedom means getting the care you need without regard to whether you can pay for it. Freedom means having a healthy society where we can all, dare I say, thrive. And the truth is, we know that the only way we're going to create that society, the only way we're going to have the freedom to live in this society as healthy human beings is to guarantee health care for all, and SB 562 will do that in California. And this is not an effort to simply score points. We are here with a mission, I like to say, a live, serious mission, and we will not stop. We will not be deterred by people who want to hide behind some notions of, oh, we can't afford it. We're not going to be deterred by notions that somehow California can't do it. All I hear is how California can take on climate change and the climate crisis. California can do bullet trains. California can do anything. Well, if California can do that, California can pass SB 562. And we know it's a new day in California, when the Health for All movement is coming together with the seniors movement, the California Alliance of Retired Americans, Healthcare for All, California Partners.
There you go.
Okay.
We're back to
We're back.
Maureen. There you go. So that's a lot of excitement, huh?
Yes, and you heard Michael say it would be like a Medicare for all system where every resident of California is covered.
Yeah.
And the healthcare the way you're treated, the way healthcare is delivered would
Right.
not change. Hospitals, doctors, everybody would remain in place.
Yeah.
But there wouldn't be the co-pays and the deductibles that make healthcare so inaccessible. And the biggest thing for me as a nurse is that the insurance companies would not be dictating your care. Your care would be back between you and your doctor, and all the other healthcare professionals would be deciding what is medically necessary, what's the community standard, what's the most efficient method of treatment.
Right. Well, how about how does this differ with some of the aspects of Obamacare, as far as the pre-existing conditions, as far as...
So the improvements that were made in the Affordable Care Act were great, and that will be folded into the Healthy California Act. So we want to improve upon what we have currently.
And this is going to be comprehensive, in other words.
Comprehensive care. Things that are lacking currently, like dental care, that would be covered.
Exactly.
Even for seniors, the Medicare Part B copays would be eliminated. So again, it would be more comprehensive care at a lower cost, and cutting out the middleman, which is the insurance company.
Exactly. You were talking about, how as a nurse, it's very difficult to be treating patients and then thinking that they cannot afford to get this kind of treatment because it's expensive, and they can get this treatment. So it's like...
The insurance company is dictating what care they get versus what care they need.
Exactly.
So I take care of patients in the hospital after they've had major surgery, and it's always a struggle and an injustice to see what they can't get that they need.
Exactly, exactly. And then for a lot of people, that's determined by what kind of plan they have.
Absolutely.
right? And so how is this going to get set up? I know that it's a work in progress, and there's still a lot of financials that need to be worked up. The Legislative Analyst Office came up with a general scope of the projection on the cost, but still that needs to be reanalyzed in relationship to the kind of cost savings that is going to happen based on the fact that now we wouldn't have to worry about the insurance companies and the overheads of administration and so on and so forth. So,
well, single-payer systems are more effective.
Right.
They can control costs.
Right.
And currently, we can't control drug prices. We can't control what the hospitals are charging. We can't control the increases in the premiums of healthcare
Right.
Insurance companies. So right now, we have an unsustainable program, and it's frankly a moral program that you get the healthcare you can afford.
Exactly. Now you have some slides here. Do you want to go over
Sure.
them? Okay. So there you go. These are excellent. So if you could just kind of walk us through, because
Okay.
healthcare is so complicated,
But we have a for-profit system.
Right.
And that's the difference is there's a lot of money that's not going to care, a lot of money that's going to marketing and extremely high executive salaries. I think I heard a figure of over $100 million are going to CEO salaries.
Exactly.
So it's not going to care.
Right. Right. And
This one talks about how we pay 3 times for our medications, our drugs, especially the UK. To me, that's incredible that we can't negotiate drug prices, and we've clearly seen the fallout this year when people can't afford the rising cost of insulin, EpiPens. I mean, there's no morality on these drug companies that just want to profit.
You know, Bernie Sanders, a couple of months ago, tried to introduce in Congress a way to control the cost. What happened to that? Do you remember that?
I don't remember, but you know, that's what all this attention now is really exposing the dark side of this. And Big Pharma, the health insurance industry,
Right.
they're putting a lot of money into a lot of people's pockets.
Exactly.
So that's what we need to do is we need to get the money out of healthcare
Right.
And provide care.
Exactly. Exactly. I mean, I think they were talking about importing drugs from Canada.
Right. That have been proven to be safe.
Yeah, and they're saying, oh, well, you know, the people, even Democrats voted against that.
Well, Democrats got some money from Big Pharma,
Exactly.
so we know what that's all about.
I know, it's really frustrating, isn't it?
It's very frustrating, but that's why, you know, we need to educate the public and we need to expose our leaders that aren't really leading for the people.
Exactly. Okay, so let's talk about.
So again, the Affordable Care Act was a great improvement, but it doesn't control costs, premiums, your copays, and again, the insurance industry still controls our access and has the power to deny medication, treatments, equipment, nursing care. And again, we know that people are self-rationing. They may be paying for a premium, but they can't access the care because they know they can't afford the copays, or they self-ration medication.
How do they self-ration medication? It's so hard for me to fathom that.
Well,
You know?
I think when you're trying to juggle whether it's between you and your parent or yourself and your spouse or child, you weigh those things. And we've heard, you know, there's horrendous stories nurses face of patients skipping meds and then having a stroke. And things that could have been very prevented. I've seen patients come in with their diabetes out of control. They didn't have the money to get tested. They didn't have the money to see a physician to, you know, get the process of proper diabetic treatment.
That's really horrible.
A lot of stuff is preventable, and that's the injustice that nurses see at the bedside every day.
Yeah. And I guess the contradiction, the irony of it is that, you know, America is supposed to be the most powerful, wealthiest nation in the world.
We're supposed to be the country that has all the opportunity in the world, and yet We have healthcare as a commodity instead
right.
of a right. And,
Yeah.
and nurses and a lot of other people that are fighting for this, physicians and community members, believe that healthcare is a right.
Exactly, exactly. And then, you know, our government gives foreign aids, military aids to
Exactly.
all these countries. Billions and billions of dollars worth of, you know, aids.
We're talking about, high-speed rail.
Exactly.
We're willing to pay for that, and that's the absolute injustice. Is that, especially California, we're this large. We'd love to say we lead the nation, right? So goes California.
Yeah.
So goes the nation. We have the 6th largest economy, and yet we are somehow okay with people being on the street and people dying because of lack of health care.
Exactly. This is just so. And then, you know, speaking of the high-speed rail, how much billions of dollars have they spent on that?
I don't know, but I think, you know,
It's like the bridge that goes to nowhere, right?
we see healthcare as a right, and that's something that,
They must have some very powerful lobbyists working on that.
right, but
you
we're
know.
better than that in California. We've led on many things. We can lead on this. and,
Exactly,
yeah.
exactly. Okay, now let's talk about.
We talked about, okay, so it's also not universal.
Exactly.
There's many people that are not only undercovered, but not covered at all,
Exactly.
right? And we as nurses know that doesn't matter what your socioeconomic status is or your immigration status, illness and disease hits us all. So
You know what's sad about this is, as far as the cost goes, and with Obamacare, I think one of the biggest criticisms that people have would be, if you're poor and you can qualify for Medicaid, you're fine. But if you're earning a living, you're a waiter, and you're getting tips, and you make $30,000, you don't have enough money, but you cannot afford health care because
Right.
healthcare are so expensive. You're looking at $300, $400 a month that you cannot afford after you pay all your bills.
right.
And then here you got the IRS after you.
It's an immoral system, and I think
it's
they
just-
say
it's
we're
incredible.
the only country where people are afraid of bankruptcy due to medical bills, and it lives with you. If you have medical debt that's unpaid, it affects the rest of your life. You can't get a loan, probably can't get certain jobs are looking at that.
Exactly. So anyway, let's look at this one.
So this is the Healthy California Act, sponsored by Senators Lara and Atkins.
That's great.
So basically, ends means testing. Everyone would be eligible by virtue of being a resident of California.
Uh-huh.
And again, the funds that we already receive through Medi-Cal, the Affordable Care Act, and CHIP benefits would be included in this trust, California Healthy Care Trust. Healthy California Act Trust. And then again, in our system now, it's a for-profit system, and so hospitals are consolidating. They don't want to serve areas that they don't feel like are making money. So this essential community clinics and other providers would have predictable, stable funding,
Yeah.
and we'd be able to serve people in rural areas much
That's
better.
great. I mean, healthcare is much needed in rural areas, especially where they don't have hospitals or.
They have to travel very far. And the other part, too, is with this, patients could go to the provider of their choice. Currently, insurance companies lock you into narrow networks.
Yeah.
And so you can't get the care you need, or you have to go out of network, which, of course, then you can't afford to go out of network because there's extra costs.
What does that mean, going out of network?
So in your plan, you're only allowed to see certain physicians or access certain hospitals and clinics in a narrow network.
Okay.
But they may not have the provider that you need for your specific illness.
God, that's so complicated.
So going out of network, you incur more costs, which you can't afford.
That is so.
It's
so
again, it's set up to profiteer off of your profiteers off
your
patients'
disease,
suffering.
right. So in other words, even like where you have a certain condition, health condition, serious health condition, and then there's a difference between the PPO or the MHO, and your physician cannot send you to a specialist right away. You have to go through the steps.
Yeah, you may be denied a specialist
Right.
and have to fight that process to get a second opinion or to
Exactly. And so you have to go through the steps before they can say, well, okay, push, here it is. You really desperately need it. Then they'll refer you to a specialist. And how long will that take?
Right. I think the system
You know?
we currently are operating under is set up so that you're constantly having to advocate and fight for yourself to get what you need. And they're hoping that you will give up and go away. And then they've,
That's terrible. And you're paying. I mean, you're
paying.
You're paying.
You're paying for care you can't afford to access.
Exactly.
We saw that one.
I mean, that's kind of sad. So what are the key provisions of the 562? This slides sort of
I think we kind of
talk about this, or we
covered
already
this one.
did this.
Yeah. Again, it puts doctors and healthcare
Here's the
professionals
comprehensive
back in charge of
benefits,
your
yeah.
care, what you need. So this is a comprehensive benefit listing. So we know that a lot of people have inadequate dental care. That would be covered. Hearing aids, alcohol and drug rehab, hospice. It's a lot more of a comprehensive program that would serve what patients actually need.
Yeah, right.
Okay, so this is a visual of the Healthy California Trust Fund. So all the revenue that we're currently getting through the ACA, CHIP, Medi-Cal, other federal subsidies would go into this trust fund. And there was a study done last year through UCLA that shows that 70% of all healthcare costs are being paid by by taxpayer dollars.
70%?
70%. So we're almost there. And by cutting out the insurance company and their administrative costs, their waste, inefficiency, their marketing, that would, I believe, save about $100 billion.
Wow, that's excellent.
So again, a single-payer system is a more efficient system, and it would save money.
So how much, in terms of the breakdown, so 45% of people's health care are covered by their employers,
Yeah.
right? So those who are lucky to have employers paying for their health care, then what's the rest? There are people who are poor people who qualify under Medicaid. There's a certain percentage, and then the rest just don't have health care? Well, there's Medicare, those people who are 65 and over.
So again, it goes into
Right.
one pile, a single-payer pile. So whether you're wealthy or whether you're
Right.
unemployed, your care will be covered under this trust fund.
Okay.
It will be, again, the funding study will be out soon, but
Yeah,
it'll be a
right.
progressive, stable financing. For most, 95% of people will save money.
Yeah, right. And that would be, so how big of a fight, okay? I mean, I guess
Well, I think, again, we're saying the time
I'm
is
kind of being
now.
facetious here. How big of a fight is it?
It's a
going
fight.
to
It's a
be?
big lift, but I think
It's going to be a big fight.
We're part of a group of 4 million Californians that feel like this is something we should
Exactly.
do.
Okay.
We should invest in our citizens. This is going to make us healthier. We can lower business costs.
Right.
People don't have the fear of staying in a job because of, so I feel like it will give people the freedom to be entrepreneurs as California is, and take away the fear and the injustice of not having care.
We only have 1 minute to go.
Yeah.
So what do people need to do?
So please, thank you. Go to healthyca.org to learn more about this and to get updates. We're calling senators that have not committed to this, and we're expecting this to go to the Senate floor on June 2nd. So definitely go to healthyca.org and learn how you can help and get involved in the campaign.
And you have rallies going on to influence the various.
I know, I believe soon there's going to be some action in Napa for Senator Dodd, who's been resistant to sign on. So look to see who your senator is and see if they're supporting it or not.
Great. And ladies and gentlemen, there we go. We have to fight for everything. You would expect that healthcare is something that we should just get, but unfortunately, that's just not the case. So, gentlemen and ladies, thank you so much for joining us again. Good night.
Thank you.